Good morning. My name is Ralf Friedrichs. I'm an addiction recovery coach, a life coach, and the host of this show, the Take Your Life Back Today show. I want to talk about the deadliest drugs here in the United States, matter of fact, throughout the whole world. How dangerous is fentanyl? Fentanyl is now the most commonly used drug involved in drug overdoses, according to a new government report that has just been recently released. The latest numbers from the U.S. Centers for Disease Control and Prevention's National Centers for Health Statistics say that the rate of drug overdoses involving synthetic opioids skyrocketed 113% each year since 2013. The number of total drug overdoses, my friends, jumped 54% each year between 2011 and 2017. There were 63,632 drug overdoses. According to Wednesday's report, which analyzed death certificates for drug overdoses deaths between those years, fentanyl was involved in nearly 29% of all overdose deaths. Fentanyl was involved in just 4% of all drug fatalities in 2011. At the time, oxycodone was the most commonly involved drug, representing 13% of fatal drug overdoses. You can see the increase. Most common drugs found in overdose deaths in 2016, fentanyl, rose, then heroin, cocaine, meth, alprazolam, coxione, morphines, and methadone, hydrocodone, desipine, and from 2012 to 2015, heroin became the most frequently involved drug in overdose deaths. In 2011, the number of fatal heroin overdoses was 4,500 drug fatalities. In 2016, that number more than tripled to 16,000 deaths, representing a quarter of all drug overdoses that year. The authors of the new study also found the most overdoses involved more than one drug. In 2017, 2 and 5 cocaine-related overdose deaths also involved fentanyl. Nearly one-third of fentanyl-related overdoses also involved heroin. More than 20% of all meth-related fatal overdoses also involved heroin. In 2017, 18,000 overdose deaths involved fentanyl, and 16,000 fatalities due to heroin. Although many experts have pointed to the overprescribing of prescription painkillers as the root of the U.S. opiate crisis, they say it has evolved, first into a heroin crisis and now into a fentanyl epidemic. Between 2011 and 2016 period examined, the number of drug overdoses involved with meth have dropped drastically. But Dr. Andrew Conley, co-founder of Doctors for Responsible Opiate Prescribing, cautioned against the figures, finding that a lot of times the other drugs overshadow these, and pointed out that the deaths from prescription opioids still outnumber heroin and fentanyl deaths. Only it's going under the radar. Fentanyl is so deadly in the geographic regions where it has been flooding in, deaths soared like we've never seen before, he said. Much of the emphasis of the drug overdose crisis has been opiates, but there have also been increases in the rates and numbers of cocaine and meth. Folks, the related deaths because of cocaine and meth and fentanyl are tremendous. In the same 6-year time frame, cocaine was consistently the second or third most commonly used drug, and the rate of overdose deaths involving meth tripled. Tripled, my friends. Cocaine-related fatalities nearly doubled from 2014 to 2016, jumping from 6,000 to 12,000 overdose deaths. The authors of the study used text analysis to analyze death certificates for specific drug mentions. They found that the top 10 drugs in the 6-year period remain the same and belong to 3 classes of different drugs. Opiates such as fentanyl, heroin, hydrocodone, meth, morphine, oxycodone were the leading causes. Such a unbelievable, staggering thing that has happened through all these years continues. The study found that illicit drugs like fentanyl and heroin were leading causes of unintentional overdoses, and prescription drugs were more likely to be involved in suicidal overdoses. And it just continues, and we'll keep fighting. Call me at 844-405-HELP because we can help each other take our lives back. Be good to yourselves and be good to each other. A simple smile to a total stranger can change their life forever. It can even change your life. Be careful when you're taking those prescription drugs that the doctor gave you. Just because the doctor says you need to take them, try never